I can share. Yep.
Yeah.
I'll go ahead and do that. All right. Can you all see the screen?
Yes.
Okay. Sounds good. So,
Right now it says loading, so I'm not quite sure.
it says
It's a
loading.
black screen. Yeah, just a black screen right now.
All right.
So your original screen before you did a presentation. Oh, there it is. It's good.
Okay. Awesome. Perfect. All right. So we will get started. Before we get started, I think it's really important to talk about our all of our identities here. So I'm going to go ahead and ask my auntie Rose to go ahead and get started with an introduction.
Bujo Nindaway Magani Doug, Anamikabane Shiko Indigenous Cause, Makwendo Dame, Made Kwe Dao. Um, my name is Rose. My Anishinaabe name is um Thunderbird Woman. I am of Bear Clan. Um, I'm a Little Earth resident. I live in the Native American community. I am first degree Mide'winwin. Been going for second degree now for almost 5 years. Um, I help a lot of people in my community, whether it be um, if somebody passes or if somebody's born, we do different cultural ceremonies for it. Um, so I'm pretty much a go-to for community resources for Native Americans in my community. Miigwech.
So, Rich Rose. I'll have Dr. Pham go next.
Hi, everyone. So my work has been mostly through Koushik and Rose here. I am mostly an ally. I have been very fortunate to be connected with this community through some of my research and clinical work. And so my job has just been to support folks. Myself, I am a refugee from Vietnam, but has been living in Minnesota almost my entire life. And I share my time at Coop Clinic and at the University of Minnesota too. So I see myself as a mentor, but in this case, I would say myself as a mentee. Thanks, Koshik.
All right. I'm Koushik. I'm a second year med student up at the Duluth campus. It's cold up here. Apart from that, I met Dr. Pham at a conference. It was Society of General Internal Medicine's conference back in 2018, I think. And we're presenting right next to each other. And ever since then, it has become a relationship without which I would not be here where I am today. And throughout this journey, we got to meet with and work with some awesome people, such as Rose, who eventually also became my auntie as well. So this work is very relational for me in many ways, and I learned and grew a lot through engagement with this work. And we're going to get into some really personal stories here. And I'm really excited to facilitate this session today. All right. So before we get started, I would like to basically acknowledge that we are currently residing on the traditional lands of Dakota, Ojibwe, and also Ho-Chunk people as well. And there were multiple treaties that went behind, the place where we are today, basically. And those treaties give us rights as U.S. citizens. Those treaties also secure rights for Native communities across our state. And I uh, I just want to basically acknowledge that. And I just want to basically also say that, I strive every day to basically hold different organizations that I work with accountable to tribal sovereignty that many tribes basically have, and to be an advocate for Native and tribal nations when asked or requested. So today's topic will feature Rose, who's a community leader from the Little Earth of United Tribes. And we'll get into a little bit of very brief history of Little Earth and why it was basically created as well. And this is a map for identifying where Little Earth is basically located in Minneapolis. And it's very close to Kook, Native American Community Clinic, Indian Health Board, all those organizations, children's, as you can see. So very brief history here. Little Earth was founded in 1973 to create affordable housing, and it was basically an initiative taken by a local Native community at that time. And it was the first urban Native housing complex with Native preference. Little Earth is basically was at the forefront of American Indian migration, which was facilitated by the Relocation Act, which gave one-way tickets to Native people to leave their reservations with the hopes of better jobs, etc. We now currently have 78% of American Indians who are living in urban areas. But the funding, in terms of different funding structures, whether it's federal or state, it's largely concentrated for reservation-based projects, which creates a huge disparity for the majority of the Native community who's basically in urban areas. Although there are programming that happens at the tribal level through contracts and stuff like that, but it's really hard to have access to culturally responsive programming. There are programs such as White Earth that are happening, but again, it's by no means sufficient enough. And outcome of that is like more amplified and widening health disparities. So this is a hotspot or heat map from the number of overdoses that happened in 2021 actually. Little Earth was basically at the epicenter of those overdoses basically. And Rose was a critical part of like the response system that went into that. And that's gonna be the entirety of this talk today. So Minnesota scores really well when it comes to health inequities profile, but like the score that we get or where we were at masks what's really happening to the Native communities. We're actually the worst when it comes to overdose rates for the Native community. So overall health outcomes really is masking what's really truly happening to the Native community. And we'll highlight some other stats as well. And before we dive into hearing Rose and her wonderful stories as well of resilience, of activism, I think it's super critical to really change our focus a little bit here and recognize that communities have been a huge source of strength. Communities have systems that help Little Earth residents navigate different crises, even before it's recognized at the health systems level, and community members know best like what's really already happening. So it's super critical to recognize the community and cultural aspects of how that played into the opioid crisis, but know that there is a different framework where tribal culture community plays a big role. And it is also the largest macro system. Many of you might be familiar with the socioecological model or social determinants of health that talks about going from micro systems to macro systems, where individuals are like the smallest microsystem. And then we have the US culture as this broader entity. But for the Native community, time and time again, tribal culture and tribal community, and for other communities too, it plays a very big role when it comes to communities looking at themselves and how they interact with others. So we're going to get into a wisdom sharing session with Rose. And before we do that, I promise I'll stop talking in a bit. I think it's super critical to highlight some important statistics because they do paint a pretty good picture of like the disparities that are happening. Although that's not the central point of this talk, the central point of this talk is also to highlight the resilience and the strength and community-based mechanisms. But it's important to highlight the statistics to situate what context those mechanisms evolved or took place. So as you can see, in terms of drug overdose mortalities, the African-American community and American Indian community within our state have been deeply impacted. What's also very more concerning is the amount of children that enter the CPS or foster care system as a result of drug use. And it's on, it's a positive slope. It's increasing every year. And there are deeply rooted reasons for that. That goes all the way back to policies that were designed to dislocate Native children from their families in an effort to assimilate them into the broader culture. And those mechanisms are still at play up to this date. So I want to basically hear some thoughts, and I want to hear some perspectives in light of the data that we just saw, what do we all think is going on? And how do you think Little Earth residents responded to that? So let's get some conversations going. What do we all think? You can type it in the chat box, or you can also speak up as well.
I guess my question to you, Koushik, is do Little Earth residents, have they ever seen this data themselves and have the opportunity to digest it versus, I think, just feel it like from a very experienced place?
I can basically ask Auntie Rose to chime in on that. What do you think, Rose?
Well, yeah, some of the studies that the groups that we did here showed a lot of different data. And this was actually one of the ones that was collected. So a lot of our residents did get a chance to see, and we had it set up in our gym where they could write the responses right on the questions that we asked. And a lot of them were touched about this subject, because a lot of our kids are taken through the system. A lot of them. A lot of our grandparents that are living here, unfortunately, are raising grandchildren. And a lot of it is due to the opiate crisis. A lot of them is due to this epidemic.
And can we hear back from our participants here? You can type up, or kind of chime in as well on the mic. Why do you think, how do you think the Little Earth community responded to this crisis, basically? I see a hand raised. Marla, am I pronouncing it right?
Yes, can you hear me?
Yes, I can.
So I come from Walpole Island First Nation. It's in Ontario, Canada, and we're losing a lot of people to opioids. I can't really speak to Little Earth, but I was traveling in Ontario in Wikwemikong, and some of the communities there launched some really interesting initiatives. My background, I work as an emergency room nurse for the Mayo Clinic, and I grew up on Walpole. And I'll be really brief. I spoke to this social worker, and she was from a community on Manitoulin Island, and they hired community reps, and I think the jobs paid, I don't know, it was a living wage, $25. They were former drug users, and they sent those people into those houses where they knew people were using. They trained them in like BLS. They gave them the, what do you call, the pens if people overdosed. And they seen a reduction from like, say 30, 35 people dying in the community to like 15. So it takes a special kind of person to go in there and to be comfortable and to be around that. And I think they went in twos. And then sometimes people would relapse, but the communication was good where, you know, they would tell the person, okay, take care of yourself and whatnot. So people had, they had ownership, you know, they felt guilty. They wanted to be a part of change. They wanted to like give back and help. So it was a really unique program. I mean, I'd like to see it come to my own community. I don't know how that would work in the urban setting, but it's just something I thought was really interesting.
Awesome. Thank you for sharing. I think we're going to get to at some point talk about similar mechanisms that took place at Little Earth as well. And one of the points that I wanted to highlight here is like how grandparents really chipped in when it comes to opioid crisis, losing community members. And I think Auntie Rose can talk a lot about that. So with that, I'm going to go ahead and go back to sharing my slides. And talk about the role as a chain breaker. And I'm going to ask Auntie Rose to kind of speak to that from her personal experience as well. So if you could, Auntie Rose, go ahead.
Okay, so I come from, my mother and my father were both addicts. My father was an alcoholic addict. So growing up, I knew what I didn't want for my children when I was going to become a mother. So being raised by my grandfather, I knew what it was like to be in a healthy home. Being that's what I didn't want for my children, was to be grown up in a home where there was dysfunction, a lot of addiction use or alcoholism. And for me, I tried very hard to steer my kids of it. But unfortunately, my kids, I've lost one son to addiction. I've actually buried one child to addiction. And I had two other sons that were heavily using. So as hard as I tried to break them of the cycle, which was, I had them on the powwow trails. We've seen a lot of it living in Little Earth. My kids were raised here. So like I said, I knew what I didn't want for my kids, but just growing up in this environment, I think really impacted them as well. A lot of things that they seen, they know that I didn't want this for them. But, I'm very happy to say today, one son has 13 months sobriety. The other son is going on a little 9.5 months sobriety. So trying to break those cycles of addiction is, I'm very open and honest with my children and my grandchildren. I've had to raise grandchildren as well as, younger siblings, nieces, nephews, because of this.
Thank you guys for sharing, Rose. I'm also going to say that the statistics that we saw, that more and more Native children every year were displaced from their homes, that's where also grandparents really had to come into play when it comes to protecting the families. And we're also going to get into the critical role it plays when it comes to recovery for parents who are undergoing treatment, and how much kids matter, or being close to your kids matter as well. So Auntie Rose, if you could give us an overview of how have grandparents in the Native community responded to the opioid crisis at the Little Earth? You could think of how your day-to-day looks like as a grandparent, taking care of your grandkids, balancing responsibilities, cultural strength, just to give you some ideas, but really what has been the impact of it? If you could kind of chime in on that.
Well, like I said, I raise grandkids, and some of my friends and people that are in the community, I used to work with the elders here at Little Earth. And I used to do a grandparents' day for the grandparents to bring the ones that were too young to be in school quite yet. But I noticed one thing that a lot of the grandparents did have in common was a lot of them were raising grandchildren permanently because their child has died from overdoses. And our grandparents were actually one of the first to bring up the fact about Narcan in the community. And I noticed a lot of, when we brought it to our community, they didn't of, I guess, with Narcan. So as residents, we took it upon ourselves to bring Narcan training into the community. That was the biggest one for us. And a lot of our elders are the ones that said, hey, isn't there something we can do about this? One day we had 9 overdoses. In one evening, we had 9 overdoses in our community. And I think it was that night, the next day we did another emergency meeting, and a lot of our grandparents were, we had lost, I think it was 3 that night that had actually passed away from the overdoses. And they were kind of just fed up. So that's when we had reached out to staff, and we started, as a community, we started doing Narcan training in our own patios. Mm-hmm. Because they didn't want us doing the training as a whole here quite yet. I mean, a lot of that has changed over time because the opiate use and the overdoses have been increasing so much that they couldn't no longer ignore it. They couldn't just try to brush it off. So, a lot of our grandparents stepping up and speaking up about the things that they go through raising their grandchildren, or, having their child that's in addiction come into the home. And it does disrupt the children. It is hard on the kids. And a lot of grandparents are afraid of the CPS system because of what they went through being removed and being put into boarding schools. So a lot of them were kind of fearful of the CPS, and some to this day still even come and ask me, like, do you know who we can talk to about this or that? Because, you know, a lot of them, like I said, you know, a lot of our kids are being born more and more addicted. So it is really hard for grandparents, I think, because some of them have come and said, Rose, we don't know which way to go. You know, our kid needs treatment, but they're scared because they don't want their kids taken. Their grandchildren hadn't yet reached CPS yet, but with the overdoses and the more that they've been coming in homes, and it's very hard on them. They try really hard to not have to deal with the system, if that makes kind of any sense. They don't have that trust barrier there when it comes to CPS. And I still have grandparents right now that are fighting because their grandchildren were taken from them because they didn't have foster care license. I do have a grandparent right now she's challenging the court system because she doesn't have a foster care license, and I don't think she's eligible for one. But it doesn't stop her from wanting to take care of her grandchildren while her daughter is deeply into addiction.
And Rose, if you could speak to a little bit about the impact of your children being taken away from you, and how does that impact the parent and the recovery process as well, the treatment process as well, that would be wonderful.
Okay, so some of the kids that do use, and I mean, they are young adults, I guess I shouldn't call them kids. Some of the young adults, when they're actively in use, they don't see the harm that's really going on. So, you know, when CPS puts a timeline like, oh, well, you have 6 months to complete this or a year to complete this, some of them are so far into their addiction that by the time they want to get sober and they want to get that help for themselves, according to the court systems and CPS, it's too late for them to get their kids back. And so some of them face that challenge of, well, why do I even want to sober up? Why should I sober up when I'm not going to get my kids back? When everyone keeps telling me this is what I need to do to get my kids or have my children is to be sober. But when that person is ready, I think a lot of people don't understand. You got to meet them where they're at.
Sounds good. And other aspect that I want to ask you about is, what are some of the cultural strengths or like values that you think really contributed to this response of like grandparents really stepping up, you know, trying to be foster parents, trying to look out for the community? Yeah, what are some of the things that you could think of there?
Could you say that again, Koushik?
Yeah, I said, like, what are some of the cultural strengths or values do you think that contributed to this response of like grandparents really taking a leadership role in the community and stepping up? Can you hear me okay?
No, I don't know what's going on with my phone. It's
Okay.
kind of jumping around. I don't know if you can hear me.
I can hear you. It's kind of lagging though. Were you able to hear the question that I asked?
No, it was going in and out. That's why I asked if you could repeat it.
I can repeat that again. I was asking about like cultural strengths or values that really contributed to grandparents taking a leadership role or taking an initiative in the community. Like, what can you attribute that to?
Well, I think just them being able to meet and talk to other grandparents to see that they're not alone in this. Also, we do have ceremonies that we bring into the community, cedar ceremonies, healing ceremonies, even as far as just like beading classes or ribbon shirt making, just things for them to do. And I think a lot of that has to do with support one another.
Thank you for sharing that. I'm gonna move on. Okay, so we're gonna go ahead and discuss a scenario that is very close to Rose. And so we have a clinical scenario. I'll read that out loud and we'll discuss that as a group as well. So we have a 35-year-old Native American female presents to the ER with complaints of right upper quadrant abdominal pain. The pain started 2 days ago, is getting worse, and patient has prior chronic pancreatitis due to congenital stricture of the pancreatic duct, and patient has no prior history of SUD. What history questions do you think this patient got asked? And you can either type in the chat box or speak up as well. Yep, I see. How much does she drink? That's a yep, okay. Anyone else? All right, we'll move on.
Koushik, could you put the slide back up so it could just stay?
Yep.
We can see it. Yeah, thanks.
If someone could tell me like what responses we're getting in the chat box, I would appreciate it. I can't see the chat box for whatever reason.
I was putting in the chat that given what you're asking here, my thought would be that although it says that there's no prior history of SUD, that there'd be questions about her alcohol use, and also since pain is an issue, questions about opioid use and the seeking of opioid pain medications in the ED.
Awesome.
I would hope that there would be more questions being asked for the etiology of this pain, and I'm seeing that Sarah in the chat is also asking about possible pregnancy.
Good responses there. Any other? Thank you for sharing that. Any other responses in the chat box? All right, we'll get going. So you're absolutely right. There were questions about alcohol use. There are also questions on, are you currently using any heroin? And Auntie Rose, you wanna chime in on, any other context here at all? Can you still hear us?
Yes, I'm sorry.
Go ahead.
So what are you asking from me here, Koushik?
Yeah, like anything else we have missed. So this is a case that pertains to you specifically, and it has happened to you, right?
Yes.
So, and the history questions that you got asked right away at the very beginning was, are you currently using any heroin, and how much alcohol are you drinking? And we're not going to prescribe you with any pain pills. So with this, and any other context we're missing here?
Well, it was the first time I had met the physician. I was actually in the hospital. And when he came in, that was the first question I was asked was, how long was I using heroin? And I kind of brushed it off a little bit. Being I've never used heroin in my life. I was never a big drinker when I was younger. I do have a narrowing in my pancreatic duct that they said if I did drink, it could, the doctor that I was seeing at HCMC at the time said it could probably kill me. And so I had to go in for several shunt replacements. They'd have to go in every 3 weeks to do a shunt replacement. And at the time, I didn't know exactly what was going on. That's why I was in the ER. I did eventually, they did find out what was wrong. But once he came in, he asked me how long I had been doing heroin. Like I said, I kind of like laughingly brushed off, like, with this beautiful physique, I don't do heroin. So the minute I wasn't an addict, I had to be an alcoholic. So he's like, well, how much alcohol do you drink? And I was like, I haven't touched alcohol since 2001. And this was in 2014, 15, maybe. And when I told that to him, he just kind of like blankly stared at me like, well, if you don't have an addiction, then, you know, what what else can there be? You know, I don't think he really took at that moment, he wasn't taking the time to consider that it could be something medically else wrong with me, which, you know, a doctor at HCMC ended up finding out was the case.
Congrats for sharing that, Rose. We're going to keep moving along through the case here. So I want to kind of take a pause and ask, and also reflect on Rose's journey as a chain breaker that we alluded to, like how much effort she put in to be in this position to take care of her family, to stay away from using any sort of substances, and because she wanted to have that role within her family. And she approached it with a sense of obligation as well. So why do we think the patient was asked these questions? Or why do we think Rose was asked these questions right at the bat?
It seems like racism.
Okay, I'm gonna take a look. Okay, incredible amount of bias, racism, okay. Any other responses from the group? That's a good response. Thank you for sharing that. So yeah, I mean, we can have a discussion about this. Racism certainly plays a major role, implicit bias, explicit bias, microaggressions, all those things. I see some other response in the chat box as well. Zip code. So Auntie Rose, you wanna kind of talk about the zip code issue here as well and how we think that might be related as well or important?
Well, as everyone knows, our community suffers a high rate of overdoses, and we do have a high volume of uses in my community, especially in the Native community. So I think that whenever they see the 55404 area code pop up and you're a person of color, that automatically, it puts a barrier up. And I think we got a lot of people looking at our zip code a lot more, especially when the Wall of the Forgotten Natives went up.
And Auntie Rose, if you could share, how did this impact you and your like future care as well, like personally, and also being a grandparent? Like, how did that really impact you? I think that would be powerful.
Well, being one that, you know, I was always afraid to do drugs and to really drink, being who my parents were. And I know that addiction runs, it's generational, you know? So, and I know that. So I think that was one of the things that kept me from being an addict, was seeing my mother and not having that bond as having a, you know, a young woman going into womanhood, and to have a mother figure to look up to. You know, my grandfather, he was Mexican, and he raised me the best he could. And I'm very thankful for that. But like, for me, it was raising my grandchildren and them having to see certain things that I try to shelter them from. You know, my sons would come over and they'd be high, and my grandchildren didn't understand that. And so, you know, in that kind of sense, you know, I'd have to tell my kids they'd have to leave because I couldn't have that around my grandchildren. As sad as it is, you know, that was one of my biggest fears, and a lot of my stress configured to my children being on the streets using. And then the fact that, you know, when the Wall of the Forgotten Natives tent city it's literally less than a block from where I live, like maybe a half a block. We've had a lot of outside people come in and just, you know, I used to do presentations at Blake School. And when the Wall of the Forgotten Natives came up, that was like, they weren't really asking about Little Earth as a whole anymore. They were asking about the Wall of the Forgotten Natives. So I think a lot of that plays into the zip code.
Thank you for sharing that. I also see some other good responses too. Being on the job for a while, provider burnout, all those things, pandemic. I think they're all related and they all play a big role. But also like just recognizing like the impact questions can have on people and what they're coming into the ED with, a super critical point here as well. And it's just like, I think what was profoundly, what really stood out to me as a med student, as I'm learning about all this is, what Rose came to the ER with, basically, and how harmful those questions can be without appropriate context. So with this in mind, I also kind of wanted to kind of refocus and talk about two different frameworks here. So best practice, wise practice. Best practice, there are studies, well-designed studies that they come up with their findings and that can inform clinical practice. We also need to be mindful of when things are already happening out there in the community members have already adapted responses. For example, as the opioid crisis was happening, the disparities that we see in CPS, Rose, as an elder, as a grandparent, stepped up. She led the movement, basically, that led to coming up with a system that could respond and really support parents who are undergoing treatment while making sure grandchildren are not being displaced from their homes, where they would miss out on critical cultural aspects of education, upbringing. All those things matter. So really take a moment to reflect on wise practices, like practices that have sustained communities from generations, and how they could really factor in, and how many people on this call as clinicians or future healthcare providers can really leverage these wise practices by partnering with communities, by asking more questions, and just reflect on systems that treat versus how do we transform to systems that heal by truly partnering with the community. Auntie Rose, you have anything else to add?
Well, I guess I have a question even for you, Koo. I'm not sure how many people are from Cook are on. Do you think that since you guys have been working with the Little Earth, with the mobile health fairs and stuff that we do here, do you think that you guys have had more Native American patients?
I don't know the current numbers, but I think that does build trust. Having my face known in the community is always helpful, my name known. And I think the fact like me and Dr. Ryan Kelly, and now then Dr. Jonathan Kirsch will be joining our crew at Cook. That trust and that relationship, the relational thing, being in that space and sharing that space together, I think automatically makes it more comfortable for people to come to us directly. So I think what you're pointing out, Rose, is that it's a shared space together. And I try my best to come with humility, knowing that there's a lot for me to learn. And I think that's true for a lot of other Cook practitioners too.
I just wanted to know what you've seen, if you think that building these communications and these bonds with people from the actual community, if you see it impact itself with yourself as a doctor.
Oh, for sure. I mean, I had huge blind spots 6 years ago when I started this work, having preconceived conceptions or how I did any sort of addiction work from my training in residency. And I was very black and white with that. The idea of harm reduction or meeting people where they're at, that wasn't part of my concept or model of care. And once I realized there were so many barriers that each individual were facing in different cultures, that I realized I was doing wrong for many different reasons. And so hearing your story, Rose, I just start realizing, man, I'm asking the wrong questions, right? I'm asking questions that's causing a lot of fear in people, and then a space that's not available for them to be transparent and vulnerable. And it's hard to be a patient, right? Because you feel so naked when you're in that room with a stranger, and to tell that story and then not feel listened and then feel attacked. I'm doing a poor job when that's happening.
And I appreciate that honesty, because knowing that I send people to your guys' clinic, and knowing that I know you, I know Ryan, I've worked with several other doctors there. I've actually found comfort. My primary doctor is actually out of Cook now. I've been with him for some years now. And as a patient, it took me a long time to build trust. especially being that I did have health issues that I didn't know what was going on with me. And I do believe that a lot of them play a part with my mother's use when my mother was pregnant with me. So there's things that I couldn't understand, being that I wasn't an active user with alcohol or, drugs. I couldn't understand why things were going wrong in my body. But over time, I was able to gain trust with a doctor there, which was really hard for me to do, especially after so many years with not having a good health provider, And the only time you kind of get that is if you go to one of our IHSs, one of our Indian Health Board, NAC, and even there you do face discrimination. And it kind of sounds weird to say that you can be discriminated against your own people when the setting is supposed to be set up for Native Americans. You still face that racism. But I mean, I really do applaud you guys. I really do, especially for the ones that are here wanting to learn more. That's always a plus to know that you guys can take the time to actually care.
Just to point out, Rose, Dr. Chris Reif is actually on the Zoom here too. Your doctor.
Hello.
Hi, good to see you. If you don't mind, what Dr. Fromm was saying is I learned a lot of this from you and your complete honesty. You mean, so I would just applaud that in you, and that gives the doctors a chance to decide, are we going to listen? Are we going to try to be on your side? So I really have learned through you personally. Thank you. And I hope I'm a better doctor with other Native people because of it. But again, applaud you for your strength, your honesty, your courage. Keep it up.
Thank you. I appreciate that. I try, because especially a lot of young ones that come to me, they don't have the strength quite yet. I'm not going to say they don't have it in them, because we all do. Some of them are scared to speak up. They feel that they can't talk to the doctors honestly. And I feel and I tell them, if you can't be honest with your doctor, who can you be honest with? Because at the end of the day, that's the person that's going to make sure that you're okay. Physically, mentally, they're going to make sure that you're okay.
Miigwech for sharing that, Rose. I think in academia, we talk about a lot about different frameworks, ideologies, and there can be a lot of work that can be done in terms of implementation. So for the next part of this session, I really would like to focus on what do wise practices even look like from Rose's perspective and from a community standpoint, and what are some of the community strengths that providers can better understand or utilize to optimize patient outcomes. So we're going to go ahead and move into that. And with that, we touched on it a little bit, but I'll ask Rose, like, what can providers do to better serve the needs of grandparents taking care of grandchildren while parents are seeking treatment? And we put some pointers in there, but we really would like to open up the floor to Rose to share her perspective and wisdom with us.
Well, I think that a lot of grandparents, the ones that are raising grandchildren, if they know about a lot of the resources and stuff that are out there, that there are resources out there for grandparents that are raising grandchildren, especially to circumstances like this. We have had a few families that I know personally that grandparents were raising the grandchildren, and the kids went to, they were seeking treatment. Sometimes grandparents, their children were seeking treatment. Sometimes it's not just you go to treatment and then you're better. It's something that our children are dealing with day in and day out. They face this, they deal with it. And now with my one son being in the sobriety that he's had 13 months sober now, he even told me that, he sees the different things that I went through helping to take care of his kids. Well, at first it was a daughter and then twins. But he even seen, you know, once he was able to sober up and see long enough, stay sober long enough to see that the impact that he was having on his kids. And I think for me, having help, being able to identify and go to different groups to help recognize, I mean, that it's okay for us as grandparents to step up and help our children when they need it, especially in times like this. You know, it's not ideal. I would never imagine my children to be battling addiction the way that they do, because it's something I tried so hard to keep them from. But raising my grandkids, it gave me a different perspective too, as you don't get to be that grandparent. You don't get to have that grandparent bond. It's more or less you went from a grandparent to the parent role. And I think it's a lot common, especially in the Native community, where you see a lot of grandparents or even aunts and uncles raising their great nieces and nephews because of this. Because I know I couldn't do it without the support of my family. My sister Cass, my aunt Jolene are very high pillars to me in my community as well. Like knowing that you have family support, knowing that there's doctors out there that will listen, I think helped me a lot.
Rose, you talked about flexibility, meeting you where you're at in terms of your other responsibilities. And so you're talking about providers who truly listen and truly are trying to be understanding to like your unique role, trying to look out for your grandkids.
Yes.
Are those okay? Okay. And you know, we're seeing some cultural liaisons or cultural brokers in the St. Paul communities at the nonprofit level. Can you tell me, like, you know, how can working with those individuals be helpful whenever those resources are there?
Well, I think that if patients knew or had the access to cultural appropriate liaisons, that it would help them a lot more asking for different things like smudging, or even like not just smudging, but being able to offer their SEMA, or people that are in the hospital, you know, being able to go out and have that connection with Creator and be able to pray and know that these things are offered to them. And there's people there that they can talk to about it that can relate and understand.
Awesome.
And I don't think they have any in the ER department. I'm not 100% sure, but I know that like when they get admitted and they're in the hospital, I know that these services are. But I mean, what would that look like if we had people like that in the emergency rooms trying to advocate and help be there for some of the people that are coming through them ER doors? Mm-hmm. Like, I think there would be a different response.
Something really to consider. I think one of the other key points that I would also like to highlight is, you know, I think as we have gone through the session, relationships have come up again and again. And for the Native community, based on my understanding and based on like my experience working with them, relationships do matter. I mean, I think Rose and her relationship with her primary care doctor speaks volumes on how that can look like here and how much that matters in terms of trust building. ER becomes a really difficult terrain for many patients, specifically Native patients, because you don't really know what you're getting into. And I think cultural liaisons or brokers or having access to them can be really helpful. And we have like an entire session I think we're going to spend on that as well, in terms of like, how do you practice cultural humility from that standpoint? I really would also like Rose to kind of talk about the community-based interventions or partnerships that we recently have been able to do as part of our ongoing conversation. The health fairs, CPR, Narcan training, and you know, like how do you think that went, Rose, in terms of like all the doctors who came to the community and the impact of that as well? So if you could speak to that, that'd be wonderful.
Well, I think that, you know, a lot of this last one we just did, we actually had a lot more people show up, I think, as far as doctors, nurses. And I think that the people that so what I got back from my community was that they liked the fact that the doctors and that were here were engaged. They were really listening to their stories and listening to them as a person. You know, they didn't just see, oh, well, here's another native looking for pills. But they actually had the time to talk to them. And I think it made them feel a little more comfortable, is what I got back from the residents here, was that, well, dang, that doctor really sat down and took the time to listen to what I had to say. And we looked at some different resources and we were able to make scheduled appointments. I was able to feel like I was actually heard. I wasn't just another native looking for drugs or, you know, seeking pills, but to actually have them be listened to and their health issues, you know, not fully addressed, but, you know, they felt validated is what I guess I can say. A lot of them felt validated. And they do, they ask me all the time, are you guys doing another mobile health fair? Or is this something you're going to be doing monthly? And I told them, I said, when we do them, I always flyer the community. I'll put it up on social media. I put it up on the Little Earth 411 page. And a lot of residents were excited and they were already asking me when the next one was. They thought it was something that we were going to be able to do like every month. And I said, well, that would be awesome if we could. I said, but the goal here is we're trying to do a bridge from how comfortable we are right now to being able to be more comfortable, to know your comfortability and walking into the emergency rooms or walking into the clinics, to have some kind of some type of a start of a relationship.
Miigwech, Rose, for sharing that. I do want to be mindful of time. I know we're getting pretty close and I want to leave a room for some questions directly for Rose. So I'll go ahead and stop sharing. I wanted to say Miigwech and Padamia for, which is thank you in Ojibwe and Dakota respectively. If you were all in person, you know, in order to support the language revitalization efforts of our Indigenous communities here, I would have made everyone like give it an attempt, but I'm not going to do that. I'm just trying to be more kind. So with that, I'm going to open the floor up to everyone for asking any questions to Auntie Rose.
I do want to say right away that Rose had an injury earlier this past week. Despite that, put this together and is here on Zoom with us. And so I feel honored to be in the same space with Rose. She is a hero and she's very humble and has not talked about all the things she's done for her community of friends and family. She has saved more lives than I have probably have saved of a doctor myself. So I always feel so humbled to be in your presence, Rose. So thank you for being here.
Thank you.
Thank you, Rose, for share everything, and Cedric was on the co-director of the ECHO. I have a question because I'm a mental health provider. One of the big questions that popped in my head is like how our role as community mental health providers, how can we bridge the gap between the person who's receiving treatment and their families and communicating with doctors? It seems like it's a huge gap between those two. And I think just having those two conversations, because our role is more so is kind of doing more family, working around those family dynamics and cultural dynamics. So to be able to advocate more for those nuances, how, is there a partnership that you can provide any information you can provide to those mental health providers that support your community?
I would say like mental health is huge. One thing that a lot of our the people here in my community, one thing is, you know, they're always afraid to go in for therapy, counseling, which, I do therapy. I go to therapy, and a lot of people are like, oh my God, how can you do that? Like it's kind of frowned upon, but I think that it would benefit a lot more people to be in for mental health, for, to be seen for mental health. And I think that, maybe you can, maybe your guys' practice for mental health, maybe we can team up and you could bring some of those, brochures and stuff to the community when we do another mobile health fair, because that's one thing that a lot of my community does lack, is identifying their mental health. And I think that just, talking to the community members, letting them know what you do, letting them know what your goal is to do, I think would help them a lot more understand than just them thinking therapy is just talking to someone and they don't listen. That's what a lot of them feel, that the ones that have been in therapy, I've had a couple elders actually talk to me about, oh, well, I feel like it's just, they sit with their back towards me and they're on a computer the whole time while I'm talking. I don't get no feedback. I'm not hearing enough feedback, or talking during the session, where they're not comfortable with going back because they feel that they're not really being heard or understood. And I think bringing that forward, like, this is what we have to offer, this is what we do, just because you need to be, because you're being seen in therapy or anything doesn't mean that like you're crazy or anything like that. I think that a lot, there's a stigma to that too. I think that there's a lot of people that'll benefit from it. I'm always one for letting people know that it's okay to see a therapist, or it's okay to get help for your mental health, because some people don't see it. I actually had a girl reach out to me today. She didn't know what to do because she's been high on meth for a few days, and she's hearing things and seeing things. And people are telling her she's crazy. And she's like, I tried smudging, I tried this, I tried that. And I just told her, I said, you gotta be able to know that you need the help. Mental health is huge on why people are killing themselves. I think that if we could get more people in to see and talk about things that they've gone through, or talk about why they're using, when it comes down to it, I think a lot of the people who do use are using to escape. They don't want their reality to be their reality. And in order to do that, the best thing you can, for in their mind, the best thing that they think is, well, let me mask it. If I don't have to think about it, I don't have to feel it, I can be numb to it. They don't care what they're putting into their bodies. And I think that, I don't think that's one of the things we offer. Is it cool at the mobile health fair? I don't think we offer mental health. I mean, we tell them there's places to get mental health, but we don't have anybody on site like that. And I think that would be a huge benefit to the community.
I think that's a great idea, Rose. We can talk about that for the next fair.
Thank you.
It is 1:15. So thank you for everyone to join us, and thank you for Koushik and Rose for facilitating this session. If you have to sign up for our mailing list, Katie put that in the chat, so go ahead and do that, and that will give you a reminder for our next Project Echo. And the last thing to know is, the other part of our Project Echo we do have co-facilitators, where we are doing more community engagement and community building for leaders who are BIPOC in doing this work too. And Rose is one of our co-facilitators for that too. So thank you for joining us. Stay safe on the road, stay warm, and then happy holidays to everyone. Take care.